Hi, well, my name is Shamy Perea. I'm Executive Director of Intermedical Solutions. It's a facilitating company and an agency in Spain. We have offices throughout Spain, and we are working with the best private institutions in Spain for medical tourism. We have our major target is going to be the United States. It's where we understand we have 50% of our market, although we will be going to other countries also. Spain right now is considered the 7th ranking in the world as a healthcare system. The Spanish people are considered the 2nd healthiest in the world. It's more like a perception of the satisfaction that they have of the kind of healthcare we have. And we are going to work to organize a cluster. My partner and I we have a private company, but we are working with the healthcare hospitals and government and state help. So right now we're going to be taking advantage of this wonderful event, which we are very impressed. It's our first time here, and we are learning quite a bit and getting good networking, good contacts. So we want to go back home and put this all to work and organize ourselves a little bit, work together with the Medical Tourism Association, which we understand is doing a wonderful role in this in the medical tourism and also in the global healthcare worldwide. So I think it's very important for all of us, and we're very pleased to be here. Okay, if I find it's positive, I do think there's a positive turn with medical tourism in the world. We're talking about in the worldwide, right? Not only considering that it's spreading and there's a lot more interest in all the countries to promote this kind of a service, because at the end of the day it's a service, it's a healthcare service. I think globalization has a lot to do with it, because there's no frontiers, and the trend is going to be just this, that all the countries are going to be no frontiers, unlimited service, so that we can, get the best healthcare services to our patients, and we are all patients or potential patients. So I do think there's been a big change, and a lot more to come. Well, I think at a start off, I think that the new reform of the healthcare reform is going to it's not going to have a positive impact on the American health system. All the contrary, I think it's going to perk up a little bit more the interest of Americans to want to find different solutions for the medical solutions abroad. I think there'll be a lot of more actors getting involved in this business in the near future, which would be their health insurance, which will be there will be a lot more agents involved in this business. So I think at a short term, maybe 4 or 5 years, it's not going to have a good impact. And I do believe that it's just going to promote that we all get organized and start working a little bit more in this type of medical tourism. I think it's going to be the tendency. It's part of globalization. I don't think we can stop it. We can not want to see it, turn around and look the other way, but it's there, and we have to all affront it. I think the Americans have to take interest in it also, because if not, they're going to lose a lot of patients, a lot of people, customers that they could keep here, and they're going to have to get into the role of being another player. I'm sure it's going to be important for them. Not yet. I'm not a member yet. It's our first Congress, but we want to become a member right now before we go back to Spain, and we want to be an active member. I've been studying for the last 2 years. I've been traveling around the world trying to see a little bit of the trends that have been going in other countries, and it has a very positive role in this business. So I want to be part of it. We want to be part of it. I believe that it is essential to have an organization like the Medical Tourism Association, because if not, we're going to all be in our little islands working each independently. But there's so many things that we could do together, and so many, just learning from the errors that others have committed, for instance, or seeing what has been positive, what other countries have done. It'll help us all get organized, because we don't want to wait 20 years to get this going. We don't want to, everybody's talking about the old, the technology, the telephone versus the cell phone. We don't want to wait 20 years to, have this trend come through. We can't afford to do this, because we're talking about our health. It's our quality of life. I think the conference is, first of all, very well organized. I have felt very close to the organization and to the association right from the start. Names, people. I felt that people have been attending us because it's our first Congress. We weren't really sure of many ways of, how they were going about it. It's the third one, the networking. I personally had many inquiries, and I've always been very, very, I have had immediate response. So that's very important. And once you get here, you feel a very friendly ambience. I think it's beautiful and wonderful to see what they're doing, not only because we are promoting a business in the same sector, but also we're getting all these countries together, all these etnias, all these races, and we're all getting together and we're working together, and there's no problem whatsoever. I think this is the kind of initiative that many industries and any business sector would need, and the association is I think it's essential for what we're doing. I think there's been a very good level of conferences. I think there's been very good speakers. I think everybody is on the same line. I haven't seen, many times you go to congresses and one speaker will have one opinion, another speaker will have another. I think everything's been very well, it's being well addressed. It's been very well investigated. So we're getting good, coherent information. I think that's the best part up until now. And just to see the enthusiasm that we're all getting, influenced by it, and I think it's something very positive for all of us. I think we're going all back home thinking that we're on the right track and we're doing what. And many people are here to see, well, is there a business here? Is it worthwhile? Is it really good? And I think we're all going to go back home saying, hey, this was well worth it, and looking forward to coming back the next year and see, sharing all of our experiences. I think it's very important. Okay, me and my organization, as I said before, our organization is called Intermedical Solutions. We have seen two phases in this medical tourism business. One is more oriented toward or focused towards tourism. Another one is, I think it's a little bit more focused towards the healthcare, quality of service, patient care. And I believe we want to get a hold of both aspects, but basically we want to impulse what is our healthcare, our quality of care, our patient, the humane aspects in this business, because it is a business. We're selling a product, but the product are people. So, and it's people's lives. So I think we have a lot to offer. Spain is an excellent destination, and I'm sure we have a whole bunch of qualities that we are going to put together, and it's going to make us a very good destination. So I do hope they will trust in coming and seeing what a good service we can give them.